Potential breakthrough in the fight against cancer.
Instead of the common biopsy, doctors are working on blood tests that can detect a cancer recurrence at the earliest, most treatable stage. CBS 2's Dr. Max Gomez is here to explain how it works.
That's right, Dick and Alice. It's called a liquid biopsy, a way to detect cancer without CT or MRI scans. And surgical biopsies require an actual lump or tumor to sample. By then, the cancer is usually made up of billions of cells. How much better to find and treat cancer when it's just a handful of cells?
Sequence the DNA.
Researchers at Johns Hopkins Kimmel Cancer Center say they've developed a blood test that can accurately predict whether some early-stage colon cancer patients will have a recurrence.
The idea that those patients who are likely to recur should, in fact, get additional therapy.
Dr. Bert Vogelstein says the new test, known as a liquid biopsy, detects fragments of DNA linked to cancer circulating in the blood. It could help doctors determine which colon cancer patients would need chemotherapy after surgery.
This is the optimum time to treat patients when they have these tiny amount of cells, too low to be seen on X-ray studies.
No DNA-based blood tests for cancer are currently FDA approved, but universities and private companies are racing to perfect the technology. Liquid biopsies rely on the fact that even when a tumor is growing, many cancer cells are also dying off. Those dying cells spill their abnormal DNA into the blood. In the Hopkins study, doctors already knew the specific mutated cancer DNA to look for from the original tumor surgery. They were looking for the earliest signs of a recurrence.
Liquid biopsies based on genetic alterations are the next generation of cancer tests.
The new study looked at 230 stage 2 colon cancer patients from Australia, but researchers say more study is needed to confirm the findings. Now, while some of the patients in the study developed a recurrence that the blood test did not pick up, the study showed that when there was tumor DNA in the blood, a recurrence was very likely. Those are the patients who benefited from early additional chemotherapy, which was good. It prevented them from getting sicker.
What are the costs of something like this?
Well, we don't know yet. This is really still just a research test, and universities and private companies are running like crazy to try to expand this beyond just a recurrence to really turn it into a true liquid biopsy. Obviously, it's going to be very expensive at first, but like everything else, the cost will come down as it's used more, the technology advances. So we'll see.
Okay, we'll keep an eye on it. Thanks very much, Dr. Max.